Hello, I'm Bill LeMay, and thank you for watching Community Matters. We hope you'll continue to watch as we discuss issues facing our community and provide you with the resources and information needed to find solutions. Health screenings are medical tests and procedures for people without symptoms to detect potential diseases or health problems early when they're easier to treat or manage. They can involve physical exams, blood tests, and imaging like x rays or ultrasounds. The type and frequency of screenings depend on factors like age, sex, family history, and risk factors for specific conditions such as cancers, high blood pressure, high cholesterol, and diabetes. Joining us now to tell us about one such screening that you can attend for free are Dalia Antunez, Program Coordinator for Community Outreach and Engagement with Duke Cancer Institute, and Dr. Ray Tan, Director of Urologic Oncology with University of North Carolina. And to both of you, welcome to the show.
Thank you, Bill.
Thank you for giving us some time and for what you're doing. Let's get to know you just a little bit. And let's start with Dalia first. Would you tell us a little bit about yourself?
Yeah, so I'm a program coordinator with the Duke Cancer Institute Office of Community Outreach and Engagement. So that just means I help coordinate various events with the office as well as provide support with our various programmings at DCI.
And Doctor, how about you?
Yeah, my name is Ray Tan, and I'm the Director of Urologic Oncology at UNC Chapel Hill and the Lineberger Comprehensive Cancer Center. And so I see patients with prostate cancer, among other urologic cancers, and also do research in the area.
I thought you guys were like rivals, and yet you are teaming up. How is that even possible? Why did it come to be?
Well, I mean, I think in sports we're definitely rivals.
Yeah,
But I
no
think
doubt.
when it comes to helping people, and especially with a very difficult diagnosis of cancer, I think we're always willing to work together.
You know, one of the things I know when we're young, we don't really think about our health. We think we're invincible. And as we get older, we kind of realize that ache and pain might be something more than we think. And that what this free screening might be all about, right? Why don't you tell us about it and the significance and how important it really is?
Yeah, I mean, I'll start if that's
Sure.
okay.
Yeah.
Prostate cancer is the most common cancer in men. It's the second leading cause of cancer death. And most of the time, patients are asymptomatic, which means they don't have symptoms. It just sort of gets discovered. And when you start having symptoms of prostate cancer, it often is at a very advanced stage. And the outcomes for men can be much worse. And so a real revolution in how we take care of men with prostate cancer has been prostate cancer screening, which is most often done with a blood test. It's called a PSA, or prostate-specific antigen. And this is a blood test that can be drawn and give us some sense of whether you could be at risk of prostate cancer.
And we're going to talk more about a lot of these items you're screening for in detail. And now you help put this together. You put it together. Who's it for? I mean, are you aiming for a particular crowd, or is it anybody who wants to come?
Yeah, great question. So this event originated about 25 years ago with the Duke Urology Department. And about 10 years ago, our office, the Office of Community Outreach and Engagement, picked it up and coordinated it and hosted it. But to answer your question, this event is open to any community member this year. Previously in the past, the event was just open to men in the community. But this year we've actually expanded and now it's open to any community member.
And I think what's important, because if you, especially if you don't have insurance, these tests normally cost money, and this event is free. And so there's nothing out of your pocket. What would you say to the folks who are watching right now? Why this is something you should take advantage of, Doctor? Why don't you take it?
Yeah, I mean, I think it's a really great opportunity just to get plugged in. We know that, men are less engaged in their healthcare in general. And so this is a really good opportunity not to just get screened for prostate cancer, but also get screened for a bunch of other health issues that can come up. We talked about how prostate cancer is the most common cancer in men, and it's a very significant cause of mortality. But even among men with prostate cancer, most commonly they will die of heart disease. So while you're getting checked for your prostate cancer, this is also get a good chance to get checked up for other things that can contribute to heart disease, like diabetes and high blood pressure.
But why don't we talk about some of the things that if you attend, you'll have the opportunity to be tested for. You want to take that?
Yeah, there's various screenings. So the participants will have the opportunity to check in. Then they will immediately go to the cardiovascular station. At that station, they have the opportunity to consent for cholesterol screening. And then after that, diabetes risk assessment. After that, they have the opportunity to also go to various stations to get screened, such as the HIV Hep C screening, the colon cancer and skin cancer screening as well. And then on site, we will have educational stations that include tobacco cessation, Duke genetics counseling, education, and clinical research representation education.
Is this all blood tests, or are you doing, I mean, is that basically what this is an event to go and get? I mean, I guess I'm wondering,
Yeah,
are you
great
going to poke and
question.
prod me? What are you going to do to me?
Yeah, great question. So we on site, both sites are clinics, and so we do have a laboratory at each site. And so once individuals consent, they do have the opportunity at the labs to get the PSA blood test, the HIV Hep C screening, as well as the cholesterol screening this year.
Now, for people who are watching, I know today, you're doing one today, but you're also doing another clinic on the 28th. I know they can just walk up. Is it better to just walk up open, or should you register? And if you should, where do you register?
Yeah, we have both options. So they have the opportunity to pre-register if you get access to our flyer or if you visit our website, but we do take walk-in participants as well.
Okay, and I know you're bilingual, and I know this is open for a lot of folks who may not speak English. Would you mind just let them know where it is and when it is in Spanish? That'd be great.
Sure. Buen día, me llamo Dalia, soy coordinadora de programas con el Instituto de Cáncer de Duke. Les queremos invitar a este evento de revisiones gratuito, dos diferentes fechas, el 13 de septiembre y el 28 de septiembre. El 13 será en Lincoln Community Health Center y el 28 será en Duke Primary Care Crosdale.
Awesome. Well, doctor, we're going to get into some of the specifics, especially prostate, but all of these things, in many cases, can be life-threatening. So it's important, and then I can find out what kind of symptoms and what people ought to do when we come back. So, both of you, thank you for being here. Stick around, and you stick around too. We'll be right back. Welcome back. With us are Dalia Antunez and Dr. Ray Tan, and we're talking about the health screening that's taking place. Something you ought to take advantage of, folks. I mean, this is a great opportunity, and from all my own personal experience, with my own family members, who, and I think we're all kind of like this. We don't want bad news. So if you're feeling something, generally you kind of put your head in the sand a lot of times, and I know that's happened with my family members, only to find out later that it was something serious. So for folks who are watching right now, we can go through some of those, and you brought up prostate cancer, and maybe we can focus on that one first. You say its symptoms generally don't show themselves until it's too late. So how important is the screening, and what do you do to find out whether or not you might have something like this?
I think the screening is a really good opportunity to get on top of it. Most organizations recommend that you have a discussion with your doctor starting in your 50s, and for men who are at higher risk as early as your 40s. And this is really a great opportunity to try to catch it at an early stage where it's essentially curable. If you are diagnosed with localized prostate cancer, almost all men will survive like many, many years with treatment. But that goes down significantly if you're diagnosed with more advanced cancer that's already spread outside the prostate.
All right. And you're saying there's really no way to tell that you have it until, there are no symptoms, right?
Well, you can get symptoms, so you can get urinary.
But it's too late then.
Yeah,
That's what you're saying.
Well, I would say that, in the 1990s, before we had this blood test, PSA, that's how men would often get diagnosed. They would come in and they couldn't urinate anymore, or they had blood in their urine, or they had pain. Sometimes in advanced cases, they would even have paralysis of their legs. And so that was at a stage where it was very hard to get people, sort of past the disease. With that blood test, we've really seen a dramatic decrease in prostate cancer mortality over the last couple of decades. It's almost a 50% decrease in the number of men who die from prostate cancer. That trend actually has slowed sort of in recent years because of the drop-off in PSA screening. So this is why we're out here doing the work, so we can see that trend start to go down again.
Is this something like you go to the doctor for an annual? Do they automatically check for that? Or is this outside that box and this is why you should be going to this screening?
I think, prostate cancer screening is a little bit of an interesting entity in that many primary care doctors do it routinely, but there's been some mixed messaging from different groups, whereas some screenings, it's like an absolute. This one is really based on patient goals and preferences, and so it has to have a dialogue with their doctor. And so it can be very challenging to fit that conversation in when you're trying to cover all the different screenings that doctors are trying to do. And so sometimes the patient has to be their own advocate and ask their doctor for it.
Well, and in addition to prostate, and I'll go to you, Dalia, is that you have a list of other items that they can be checked for. Again, a lot of these, I would assume, if you have a primary care doctor, could be addressed there. Are the folks that you're kind of reaching out to folks that may not have insurance, for instance, or are too macho, for lack of a better way of saying it, or maybe not just part of the community that need to come in? I mean, how do you draw these people in, and who is it for specifically then?
Yeah, so I would say the majority of the men previously that we have navigated into care post the event, they have been disconnected from their primary care provider in the last couple of years. That's very common to hear. I would say around at least 50% of the participants lack insurance, so we're connecting them to local federally qualified health centers, or if not, we are also connecting them to insurance navigation teams.
Well, I know when I was younger, primary care doctor, I really didn't have one because I didn't need one. As far as prostate cancer, is that something that shows up in young men, or is that primarily an older man disease? Or, you know what I'm asking?
No. The sort of the typical age of men diagnosed with prostate cancer is around 65, but certain groups of men, it can present much earlier. So for people at really high risk of prostate cancer, we actually recommend screening or at least talking about whether you want to get screening as early as 40. So there's some groups that you can just develop prostate cancer much earlier. There's some genetic links. So there's actually a link between breast cancer and the breast cancer gene and developing prostate cancer, and that can really lead to some people developing prostate cancer much earlier on than expected.
When you say high-risk groups, is that what you're talking about, the genetic factor? Is that primarily it?
It's really two things. It's genetic factors. So if you have a really strong family history of prostate cancer, that might suggest that you're at higher risk. We also know among Black men have a 70% greater risk of developing prostate cancer and a higher risk of dying from prostate cancer. And so they're also a very at-risk group.
Well, here's an opportunity for you folks. I mean, to check it out. And I know this is how I am. If you're feeling something or you're worried about something, go get it checked out. It's better to know, right, than to not know and catch it early. We'll come back. We have a lot more to talk about. I hope you'll stay with us.
Buen día, me llamo Dalia, soy coordinadora de programas con el Instituto de Cáncer de Duke. Les queremos invitar a este evento de revisiones gratuito, 2 diferentes fechas, el 13 de septiembre y el 28 de septiembre. El 13 será en Lincoln Community Health Center y el 28 será en Duke Primary Care Crosdale.
Welcome back. We've been discussing the prostate cancer and health screening that's coming up on September 28th. And to both of you, I want to just say thank you. It's a great opportunity for folks who are watching, and spread the word, folks, to take advantage of this. And I think you should. For folks who are wondering, well, I don't have all day to do this, and I'm perfectly healthy. What can they expect, Dalia, when they go? I mean, how long is it going to take? What's the process like?
Yeah, great question. So essentially, this is an opportunity to get access to free health screenings. And so once participants arrive, they have the opportunity to check in at registration. Following that, they are required to go to the cardiovascular station where they will have the opportunity to also get screened for cholesterol. They will be assessed for ADA diabetes risk assessment. After that, they will be going to the prostate informed decision making station if they are men. And then after that, they have the opportunity to select from the following stations, which include colon cancer screening, HIV Hep C screening, tobacco cessation. We also on site will have educational stations that include genetics counseling as well as clinical research representation. So it's a really great opportunity to get access to all of these free health
Man, I
screenings.
mean, you're opening up the hood and going for it.
Yeah.
It's a complete kind of, it's like plugging into a computer and getting that error if you have one. Speaking of which, if you get you go through all these tests, when does the individual learn whether or not he or she has an issue, and who contacts them, and then what happens next?
Great question. So on site, they will be able to get the results for their A1C screening, and then on site they will also get their results for some of the cardiovascular screenings. But post the event, they will be receiving their prostate PSA cancer screenings as well as their FIT kit if they decided to take a FIT kit at the colon cancer screening. As well as post the event, they will get their cholesterol screening results.
No, doctor, you had said that in the past, there's been more and more men that have been discovered with this and earlier than later, which has been good. Overall, when you look at all the things that are being screened for, they seem kind of connected. Can you kind of put it together for us? And you talked about risk, the people watching today who might fall into a high risk group. What is that high risk group?
Yeah, thanks, Bill. I mean, excellent question. And as we mentioned before, as I mentioned before, high-risk men include those with a strong family history, as well as those with African ancestry. But it's still, outside of those groups, still a very common cancer. It's the most common cancer in men. I think this event is really fantastic for men's health. We talked about how prostate cancer is the most common cancer in men, and so. It's a big thing that we want to try to address. The good news is that prostate cancer, when detected early, is very, very treatable. And what's interesting is most men who are diagnosed with prostate cancer will actually end up dying from heart disease. And so this is a great opportunity with this health screening event that we can start to introduce men to the idea of screening for diabetes, checking their blood pressure, stopping tobacco use. Getting the cardiovascular risk assessment, all the things that may impact them health-wise down the road. And so we're using prostate cancer sort of as an introductory into the sort of the healthcare system, and then we're starting to address the downstream things that they may run into. We can really make a lot of improvement in health for men.
Are they connected in any way? I mean, it's your body, and one thing affects another, I suppose, or is it just simply, this is come in, get the prostate, and let's see what else is going on?
Yeah, I mean, that's a really interesting area of research. There's a lot of work that's being done looking at plant-based diet, different nutritional aspects that can contribute to prostate cancer and also may help reduce the progression of prostate cancer among men who have it. I mean, there's a lot of active research going on, I'm sure at Duke and over at UNC and around the country. But I think in general, being healthy probably helps you out just because everything is connected. And so I think this is a great opportunity to try to start working on that.
Yeah, as a nation, I guess we're starting to talk about it again. We're pretty unhealthy. It'd be nice to get back into shape. I see the beach pictures from the 70s. It looks a little different today. Now, I think you mentioned too that at the screening there are opportunities for information, educational opportunities. Did I miss here, or is that going on as well?
That's correct. We have a few educational stations, and they include genetics counseling, tobacco cessation, as well as clinical research representation education.
All right, so as we're running out of time here, for those who are interested, where can they register, and where's the event going to be on the 28th?
Yeah, so on the 28th, we will be at Duke Primary Care Crossdale in Durham, North Carolina, and the time for that is 12 p.m. to 4 p.m.
All right.
And they can connect with us. If you have access to a flyer, there's a QR code to pre-register, as well as our website has that information for the screening event.
Well, thank you both for doing the show and for what you're doing. I hope you get a huge turnout. Keeps you busy for at least 4 hours or more.
It will, for sure.
All right. Well, thank you very much. And thank you for watching. We hope you've enjoyed today's show. If you have any questions or would like to know more, visit our websites at RaleighCW.com and myrdctv.com. I'm Bill LeMay. Thank you for watching Community Matters, and we'll see you next week.
Buen día, me llamo Dalia, soy coordinadora de programas con el Instituto de Cáncer de Duke. Les queremos invitar a este evento de revisiones gratuito, 2 diferentes fechas, el 13 de septiembre y el 28 de septiembre. El 13 será en Lincoln Community Health Center y el 28 será en Duke Primary Care Crosdale.